Aphorism 229. On the other hand, contradiction, eager explanation, rude corrections, and invectives, as also weak, timorous yielding, are quite out of place with such patients. They are equally pernicious mode of treating mental and emotional maladies. But such patients are most of all exasperated and their complaint aggravated by contumely, fraud, and deceptions that they can detect. The physician and keeper must always pretend to believe them to be possessed of reason. All kinds of external disturbing influences on their senses and disposition should be, if possible, removed. There are no amusements for their clouded spirit, no salutary distractions, no means of instruction, no soothing effects from conversation, books, or other things for the soul that pins or frets in the chains of the diseased body, no invigoration for it, but the cure. It is only when the bodily health is changed for the better that tranquility and comfort again beam upon their mind. Explanation. In this aphorism, Dr. Henneman has given idea about conduct with such a patient. On the other hand, contradiction, eager explanations, rude corrections, abuse, insulting behavior are of no use or not coming in list of mode of treatment, as patients are quite weak, nervous, and timid with lack of confidence. Such a mode of treatment are harmful modes for treating mental and emotional diseases. But such a patients are most of all intensely irritated and frustrated, and their complaints are aggravated by abusive, fraud, and deceptive behaviors they found in surrounding people. The physician and caretaker must pretend always to believe them by giving them strong reason, by understanding their perception. All kinds of external disturbing influences on their senses and disposition should be removed if possible. There should not be any entertainment for their troublesome spirit, no salutary distractions, no means of instruction, no soothing effects from conversation, books, or other things, for the soul that remains always anxious in the chains of the diseased body. There is no vigorous energy to impart, but most gentle care is required when the physical health is changed for the better. That comes back in state of tranquility and comfort again to give support upon their mind. Footnote 126. The treatment of the violent, insane, maniac, and melancholic can take place only in an institution specially arranged for their treatment, but not within the family circle of the patient. Explanation.